everybody. I'm Bob Oliverio. As promised, this is our COVID vaccine town hall for all our teammates who are interested in knowing more about the vaccine, some of the reasons to get it, answer your questions about the vaccine, and hopefully help you make some decisions in the near future. If you've got an invitation, it's because you're still thinking about it. And I want you to think about it, but I want you to have all the information. And to help you give you that information, I've got two of my favorite people with me. This is Dr. Ellie Oakman. She's OBGYN here at Roper St. Francis. And this is my right-hand person, Severia Meggett. She's my CMA, and she works with me up at the Greer Transitions Clinic. And so very lucky to have them here and available to take your questions. You know, we've got over 50 people on the WebEx. Which means, you know, if you're sitting alone thinking about this, you're not alone. So I want you to remember there's no question that shouldn't be answered, that shouldn't be asked. So we're going to ask to get your questions through the chat function for corporate communications. So just make sure you use the chat function, and that's what we're here to do. We're here to answer your questions. But first, I just want to give you a little level set and let you know what's going on with the health system and nationally with the COVID vaccine. So this is what we've been doing for the past 100 days. Our vaccination efforts just finished at the North Charleston Coliseum. The drive-through vax event was fantastic. We got over 50,000 first doses. 48,000 second doses for almost 100,000 total doses given to the community. I got to work up there, and it's been a lot of fun. Z, were you up there?
Yep.
Yeah,
it was great.
Yep. So it was a good time, and I think the community really appreciated it. It was one spot. So what we want to do is we want to make this vaccine as convenient as possible. So we're moving the vaccine out to all the express cares. And that's going on now. So all 5 of our express cares have the Pfizer vaccine. And we want to make it as easy as possible for you to get that vaccine. So we're going to be moving to walk-in status, 8 to 8, Monday through Sunday, as soon as possible. And right now you can call 727-DOCS, get a little bit of a time to get a vaccine, and we'll get it to you if you're ready to do it. Where are we now with our teammates? This is actually pretty good, all told. We have 65% of our teammates with both Pfizer vaccines given, and that's actually great. We have 5% of our teammates who are in the middle, are getting, have gotten one vaccine and are waiting to get their second vaccine. But there's still fully 1/3 of us who have not gotten our vaccine yet. And in order to get to what we call herd immunity, where we can actually get back to normal, we have to be 70% or better. And the higher the vaccine rate we have, the more normal we can become, and the safer it is for our patients and for our teammates. So this is what we've been doing since December of 2020, vaccinating folks. And you can see here the number of vaccines we've given. So 300 million shots over the course of the past 6 months or so. Now, this is one of those things where I'd like to show you what's happened to COVID during that time. And this is what's happened to COVID. These are deaths. These are people who die from COVID. And you can see the more shots we give, the fewer people die. And that's really the point of these 2 slides. I wish I could have put them on top of one another so you could see even better, but that's what we're trying to do. So, what we do is we talk about our 3 C's of hesitancy. There are good reasons to wonder about the vaccine. And one of those C's is confidence. Are you confident that the vaccine, is effective? Was it made too quickly? Are we telling you everything you need to know? That's one of those things. The second thing is complacency, and it's not that people are not getting the vaccine because they just don't care. It's basically I've gotten COVID, so I don't need to get vaccinated, or I'm too young, I'm not going to get sick, or I don't go out and I'm not going to cause any problems. And then the last C, and this is the one we're trying to, take care of with the vaccines going to the express carriers, is convenience. How can we make this as simple, as easy, and as convenient as possible for you? So I'm expecting some questions about these 3 C's and any other questions that you have. Again, chat box through corporate communications. That'll get us the questions. And I've got these two wonderful people to help me answer these questions. Oh, and one of the things that you got to check on, our wellness works. At the end of the summer, we're going to be tallying up those points, and if you get those 101 points, your health insurance premiums are lower. And a great way to get those points, you get your vaccine series done, you automatically get 25 points for that.
Dr. O, we already have a question from the crowd. They want to know, do you need a doctor prescription if you're a teammate and you want to walk in and get the vaccine?
Absolutely not. So this is one of those things where we want to make this as simple as possible. So if you are 12 years or older, you can get a COVID vaccine. There's no doctor's prescription necessary. You don't need to have insurance. You don't need to have a dime in your pocket because there's no out-of-pocket expense. These are free, and basically it's kind of like a flu shot. You just go in and get it.
Repeat this question when I say it.
Oh.
Does RSFH plan to offer the Moderna vaccine?
So the question is, does RSFH plan to offer the Moderna vaccine? Our plans are really determined by what happens with the South Carolina Department of Health and Environmental Control. And so depending on what we get and what vaccine's available, that's the vaccine we give. Right now, we have Pfizer. We still have a lot of Pfizer available. So, we have no plans to move to Moderna, but Pfizer's readily available. These vaccines all have equal and awesome efficacy, upwards to 95% effective. So if you get Moderna, you get that kind of efficacy. If you get Pfizer, you get that kind of efficacy. If you get Johnson & Johnson, you get that kind of efficacy. It's a wonderful vaccine.
Here's another question, and repeat the question. I'm worried about how fast the vaccines were developed.
So the question is, I'm worried about how fast the vaccines were developed. And I think a lot of people were wondering about that too. We had been talking about, masking and all that kind of stuff and watching a surge. And all of a sudden, between October and December, these announcements about the vaccine came out. And, the one thing I will remind folks is these vaccines have been in development. This type of vaccine, particularly the mRNA vaccine, has been in development for over 20 years. And, we've been using these things for, diseases like Ebola, Zika. These are all sort of tried and true vaccines for those sorts of things. Now, this is the first time in the United States that this vaccine was mass produced and driven out this fast across the country. But, any kind of vaccine, this is a remarkably fast way of getting this stuff out. So I knew about the technology, I understood the technology, and I was not concerned when I got my vaccine. How about you, Z? No problems?
No problems.
You didn't think about it?
Nope.
Yeah.
No, and I'll add that, like you said, the technology has been out there for a really long time, and we know that it works. We just haven't had a virus that we needed to mass produce this type of vaccine before. And we would have done it with avian flu a few years ago, but we didn't need to, luckily. The other piece to it is that we had a lot of money put into it to make it go really fast. And in normal vaccine production, we spend a lot of our time trying to get grants at the NIH level for research and development. And for this vaccine, we didn't have to spend the time doing that. So for example, for the HPV vaccine that came out for cervical cancer prevention, it took us about 20 years to get it out. I'd say about 15 of those years were just getting funding and sort of watching it get developed. If we can get $1 billion given to make a vaccine, we can make all the vaccines this quickly. So
this next question goes to Dr. O. Repeat the question. soon-to-be pregnant mom be worried about getting pregnant, getting the vaccine?
Sure. The question is, should a soon-to-be pregnant mom be worried about getting the vaccine before or during pregnancy? The recommendation from ACOG, which is the governing body for OBGYN in the United States, is to get the vaccine. We have great data so far on the efficacy and the safety of the mRNA vaccines in pregnancy, and also the Johnson & Johnson vaccine, although it's been less utilized in pregnancy because these Pfizer and Moderna have been out a little bit longer. We are recommending that any pregnant patient who's offered the vaccine get it, even during pregnancy. And also, if you're trying to get pregnant, it's a great time to get the vaccine, because that way you'll have antibodies in your system before you get pregnant. A new study just came out looking at the efficacy of the vaccine for patients who got the vaccine during pregnancy versus patients who got COVID during pregnancy. And not only do the patients who got the vaccine do a lot better, because COVID in pregnancy is horrible, their antibodies were actually higher for those who got the vaccine than had COVID. And for those patients who were breastfeeding and postpartum, their antibodies after getting the vaccine were higher again than those patients who had COVID. So we're seeing a better response for patients who are pregnant, breastfeeding, and before their pregnancy in getting the vaccine over getting the virus. So we definitely recommend it.
This question's for the panel, and repeat the question. Is teammates concerned that RSFH might make this mandatory for all teammates with the vaccine?
So the question is the concern about mandatory status for the vaccine. You know, we basically use flu vaccine to keep the incidence of flu down with our teammates, and that's a condition of employment. And so, will this happen at some point for the COVID vaccine? You know, right now the thinking is this is still under what we call an emergency use authorization. So that's a little bit different than FDA approved. What this says is, you know, the government and the CDC and the FDA feel that the benefits for this vaccine far outweigh the risks, but there are not, you know, long-term studies as of yet with regards to the efficacy of the vaccine and potential side effects. Once those studies are done, and they are ongoing, this will become FDA approved. One of the things that we're going to have to think about as a system, and I think a lot of other employers are going to be thinking the same thing, is, you know, if this is FDA approved, do we make it mandatory? And frankly, if this is as lethal as it is and as persistent as we think it may be, you know, this is worse than the flu. You know, you're talking about a death rate of 18 times of what we're getting with the flu. So why wouldn't we make it mandatory if we've proven that it's safe and effective? Any concerns about that?
No, and we also know that the vaccine is actually more effective than the flu vaccine.
Correct.
Right now.
Are teammates who got vaccinated somewhere else, are they included in our vaccination numbers as a teammate?
With regards to our vaccination numbers, our teammates who get vaccinated elsewhere, are they included in those numbers? We're working on those numbers, not all the time. So we do have docs who work at different hospitals and have gotten vaccinated at different hospitals. We know who hasn't been vaccinated, and we're just asking, you know, did you get vaccinated, so we can get up to date. You know, several of the docs have gotten vaccinated at Trident East Cooper. We're updating our roles for, you know, with that information. But one of the things that we would really appreciate is if you did get vaccinated elsewhere, you know, either at a Walgreens or, you know, at a different health institution or at a walk-in center, you know, just let your manager know, and then we can get that information back, put that in our roles, and get our numbers up.
This teammate wants to know, did all three of the manufacturers use mRNA technology?
So the question is, did all three of the manufacturers use mRNA technology? No. So for those vaccines, and there are multiple vaccines out there. The main ones that we're talking about are, you know, Pfizer and Moderna. Those are both mRNA vaccines. And then AstraZeneca and Johnson & Johnson are an adenovirus vector vaccine, which is a little bit different. So basically, you know, the way these work is there's got to be some way of getting a little bit of instruction into the cell in terms of how to recognize, a foreign body, a virus. So, some of these vaccines use a little bit of think of it like a soap bubble. That's pretty much what it is. And inside that soap bubble is a little piece of instruction that tells your cell how to make a protein that your body can recognize. That's the mRNA vaccine. And then they have this other way of doing it, the adenovirus vector vaccine, which is a killed virus, but it still can get into the cell. And it's got information that allows the cell to do the same thing. So really, that's the big difference between the two types, mRNA and adenovirus. And there will probably be other ways of developing this vaccine in the future as we get better about it. And more companies get emergency use authorization, go through studies.
If everyone around me is vaccinated, why do I need to be vaccinated?
Okay. The question was asked, if everyone around me is vaccinated, why should I be vaccinated? Well, first of all, we all need to be vaccinated so we can get this herd immunity going for everyone. And like my family, I made sure everybody got vaccinated because even though we're vaccinated and you go to work or you go out, people around you still not vaccinated, so that prevents you from contacting COVID or bring anything home to your family or your loved ones. So I feel like even though everyone around you are vaccinated, it's still a good choice for us to be vaccinated.
Okay, let's get you to take the next one.
Okay.
This person says, I've already had COVID, or I think I had COVID. Do I still need to get vaccinated?
Okay. So the question is, if I had COVID, do I still need to be vaccinated? Yes. I explain to my patients all the time, and that's the question they ask. I had COVID, so why should I need to be vaccinated? So I explain to them that, you may have antibodies from having COVID, but it's still safe for you to get vaccinated. That way you'll be, covered. I know you still can get COVID once you're vaccinated, but even though you had it, it's best to get vaccinated again.
This next one, this teammate really has a scenario they want to share. My brother, who's in his 30s, had an adverse reaction to the Pfizer vaccine, namely debilitating headaches and nausea that lasted for months. He's the only family member who had any problems, but it's caused concern for this teammate. Do you foresee that the vaccine manufacturers will reformulate or change the dosage recommendations based on these types of scenarios? How far in the future could that come?
So the question is, if there are vaccine adverse events, reactions, and that happens frequently enough. We have a teammate who had a relative who had, debilitating nausea and headaches, and that lasted for months. Would that be a reason to change the formulation? And there's a vaccine, adverse events registry that all these adverse events are supposed to be, sort of put into. And really, it's not about one person. It's about how does this affect the population? How does it affect, everybody? And I can tell you personally, when I got the Johnson & Johnson vaccine, I was in a study. And, I got it at 6 o'clock in the evening. And by 9 o'clock, I was going to bed. And I thought, well, I probably got the placebo. But by 3 o'clock, I knew I had gotten the vaccine because I got fevers and, chills and muscle aches. Normally, these are short-lived. And they, for me, lasted about 6 hours or so. I took some Tylenol, felt good enough to go back to work the next day. So that's usually the way, people react if they are going to react. It's relatively rare to get that kind of a reaction. So, at this point, we expect some level of reaction to the vaccine. It just means your immune system is, acting on it, because it's acting like it's a virus. It takes care of it, and you're better within 6 hours. I think that instance where the person was, really sick for months is probably, that's an outlier. Doesn't decrease the significance of that. And again, that's something that person's going to have to think about when they get the vaccine again. But that is not representative of the way people react at large to this vaccine. Usually, there's relatively low level of reaction, particularly with the first dose, and then maybe double that level of reaction on the second dose, and usually not debilitated. I don't know. What do you guys? Do you have any vaccine stories that?
Yeah, we have vaccine stories all the time, and that's some people be leery about because like headaches, pain, muscle aches, vomiting, nausea. But like I explained to some of our patients, everybody don't have the same symptoms. And when I got the vaccine, I was fine, and the next morning I had like headache and fever, but after like 5-6 hours, it was gone. So like I told them, it don't last, long. And that's just part of the side effects from the vaccine.
This next is a kind of a question from a teammate that's been asked of them, and you don't need to repeat it because I have a microphone on. The comment has been made to me, why get the vaccine if the % of effectiveness is less than the natural ability to fight COVID for someone without pre-existing health issues? What should this teammate say when they're asked that question?
So if I understand the question correctly, why get the vaccine if the side effects are more likely than a person who actually gets COVID and having bad reaction?
Yeah, they don't have any pre-existing conditions.
Right. Yeah, it's okay if it's just you, but the fact of the matter is this is actually a pretty infectious disease, more infectious than the flu. And so, if you don't get it, if you get it and you do okay, thank God, right? But the fact of the matter is anybody that you come in contact with, even before you're sick, if you get infected with the disease, you may be shedding virus, and that virus may infect somebody else. You don't even know you gave it to somebody, and you're the guy who infected the little old lady, and you don't want to be that guy. That's the reason to get the vaccine. It's not so much about it wasn't about me. I don't have pre-existing conditions. Knock on wood. If I got it, I think I would do okay. I just don't want to be the guy who gives it to my grandmother. I don't know. What do you guys think?
I had a patient who had a similar situation actually, and her brother didn't know he had COVID, came to visit the family and gave the entire family COVID, and sadly her mother died. She was in her 80s and died of the COVID that her son had given her, and he didn't have any real symptoms. He found out he had COVID right after he had come to visit them. That happened back in March. And so I think that's the biggest reason I tell people to get the vaccine, is that probably the scariest thing for doctors and epidemiologists is that we pass this virus on without any symptoms or any sickness, especially young, healthy people. And when you get something like the flu, you tend to get sick and you sort of self-isolate, you have fevers and feel bad pretty much around the time you're shedding virus. So on average, when you have the flu, you only infect one other person. With COVID, you don't necessarily feel bad, or a large percentage of people don't feel bad, and those people go out into the world and infect 20 people or more. And those are really the scary things for us, because we cannot control the spread of disease by just watching out for symptoms, because you can spread it when you're not sick. So I would absolutely encourage people to get it, because really you're protecting other people from the virus and from you spreading it when you think you're well. And there's going to be a small percentage of people who cannot get the vaccine, either because of their health conditions, their allergy conditions, or their age, because right now it's only approved for 12 and up. And so we have a large percentage of people in the country, especially children, who cannot get vaccinated. And so we encourage everybody to get it, really because you're protecting your neighbors and your family and everybody in the community.
And what I would say is, you see people now, basically there are no masks. But we know that, 40% of people in Charleston are vaccinated. That means 60% are not. So, you've got, 1 out of 3 people who are vaccinated, whereas 2 out of 3 people who are currently not vaccinated. Well, you don't see 2 out of 3 people in the store with masks on. You see 0 out of 3 people with masks on. So, there's still, the possibility to spread this disease. And so, if you want to protect other people, particularly when those other people are putting their guard down, maybe a little early, they should be masked, but they're not. I think I would be the guy, I would want to be the person who gets vaccinated so I don't give those people COVID.
This teammate is concerned about things that he or she has read that the government could have put a tracking device in the vaccine. What would you say about that?
So the question is, tracking devices in the vaccine, is that possible? No, it's not. Basically, there's really no technology available currently that would make that happen. I've also heard, people concerned about, getting a tracking device up their nose when we swab them, and we've done a lot of swabs. So, we've heard that too. And, I understand, it's actually one of those things that's been going around for quite some time. And, it always goes around when we're talking about doing things for the entire population. But there's nothing in that vaccine. We know the ingredients of the vaccine. It's done by different manufacturers. It would have to be number one, really awesome technology that doesn't exist, and number two, this sort of a complete conspiracy that a lot of people are involved in. That just doesn't work. So it makes no sense to worry about that. That's not what people are trying to do. I don't know. What do you guys? Have you guys heard the same thing?
I hadn't heard the tracking device one.
I ask about the tracking device all the time.
Yeah, I had to go through. There was a patient who went, basically said, what do they want to track? What do you? It's like,
I think they can track you on your phone anyway. So.
Yeah, exactly. They already got you on your phone. That's right.
So maybe we would just like to speak up and say this is the last call for questions. You guys have answered all the questions. I wonder what.
I was going to say the only other question I hear a lot is this risk of fertility issues that seems to be out there on the internet somewhere. The way, especially the mRNA vaccines work, the Pfizer vaccine or the adenovirus vaccines are very like the flu vaccine, so we know that there's no risk long-term for fertility. We've used those for years and years. As far as an mRNA vaccine goes, our mRNA is messenger RNA. It's a messenger of your DNA. And when we put it inside your muscle cell, it goes into the muscle cell. It does not go into your nucleus. It doesn't change your DNA in any way. It sends a message into a part of your cell that then copies it, makes a protein, and then the mRNA disintegrates. It's actually the reason that we have to put it into another molecule to keep it in there because it's so unstable and it goes away so quickly. Once that happens, that muscle cell produces the protein that looks like coronavirus, and your antibodies start to work on it, and the mRNA is gone. So nothing ends up crossing the placenta or going into the uterus except for antibodies that fight COVID, which is exactly what we want, right? Normally, when you're pregnant, you send all of your antibodies through to the baby, and those are all the ones that you've experienced and made over your lifetime, and those are the ones that you want. So there's no physical way, physiologically, that you can get infertility from the mRNA vaccines. It doesn't work the way that it's produced or the way that it happens.
Let me ask the panel, are there any myths that weren't addressed or any concerns that you hear in your practice in seeing patients that you want to address in conclusion?
Well, I think we talked about the confidence, is this something that the government is pushing on us? Is this something that actually works? Is the technology sound? Those are things that we hear a lot of, and those are the hardest things to overcome because, it's hard to prove a negative. It's hard to say, it's like, this is not happening. That's the hardest thing to do. The complacency, I think we also talked about, which is, why should I get it if it's not going to harm me? And the convenience thing is, that's what we're trying to do in terms of getting the vaccine out to the public as easily as possible. I don't think that there are a lot of other concerns. I know, there are probably other questions that people will have, after this is over, and I'm sure that we can take those questions and answer them. That's one of the things that I think we need to remember is this is a dialogue, and we're all here to talk about this. And if anybody has questions, ask somebody who's gotten the vaccine. What do you think? That's probably the best way to get these things answered. If you hear, rumors, ask about it. We've all heard the rumors. We all got the vaccine, and we did fine. The one thing I have heard is, does it make you sick? And like, is the sickness that you get the vaccine worse than COVID itself? And that the one thing I will say is, we've given 100,000 shots just in the vaccine clinic alone, and not one of those people have ended up in the emergency room or in the hospital admitted because they got a COVID vaccine. We still have people in the hospital because they got COVID, and that's the way it's going to be. So the risk of the vaccine is so minute in terms of bad effects, and it is zero in terms of death. You do not die from COVID if you get the vaccine. But if you don't get the vaccine, you can die from COVID.
Can you remind our teammates who are on this WebEx how they can get the vaccine at our Express Cares, how to schedule that, and where our Express Care locations are located?
So the question is, how do you if you want the vaccine, how do you get it from Roper St. Francis? Well, the good news is now, like I said earlier, we're moving the vaccine out to our Express Cares, and they're open 7 days a week. Initially we're scheduling appointments, so you can schedule an appointment today if you call 727-DOCS, and basically they'll give you a choice of one of 5 locations. So we got Express Care out in West Ashley Circle, out in West Ashley. We've got one on University. We've got one in Ladson. We've got one in James Island, and then the other one is Somerville. Yep. So those are the 5. Those are the 5 spots, and we got plenty of vaccine. So the hours right now, we're trying to get people in between 2:30 and 5:30. But as soon as we figure out how to do this easily, and we've already seen, our Express Care teammates basically just, people are walking in, going to the wrong spot. Doesn't matter. We'll give you the vaccine. We got it. So that's how you get the vaccine. If you make the appointment 727-DOCS, that's probably the best way of doing it. But very soon we're just going to have you walk in, 8 a.m. to 8 p.m. 7 days a week, and I can't make it much easier than that. So I think that's all the questions that we have. And again, like I said, if there are other questions that come up, please, email corporate communications. We're going to be, this is an ongoing conversation. I really want to thank the folks who came out and helped me answer these questions. Dr. Oakman, thank you very much. Z, Javaria Meggett, she's the best. She's delightful. And thank you guys for taking the time after a busy day to actually sit down and ask these questions, and hopefully, think about this and weigh the possibilities, the alternatives. And again, we'll make this as easy as possible for you. Anything as you want to say and wrap it up?
No, I just encourage everybody who's able to get the vaccine.
Yeah, get the vaccine.
All right, well, thank you all for coming out. I want to thank Andy Lyons, Corporate Communication, Nicole Stevens for putting all this together. And I hope this was helpful. And if you want some more information, let us know, and we may do this again. Thank you.